welcome to the Halloween TED Talk on xylazine and xylazine, and we will also cover puffy hand syndrome for all you folks that are new. Hi! I am not a nurse. I am not a psychologist. I'm not public health. I am a lowly medic. I was an ICU tech and an ER tech. I worked on fire department for 20 years. This is why we can't have nice things. This is why all my pens are missing. And this one's eating a bully stick because I had to get a new one because this is now my pointer. Because this one took my Chef Carl pointer. So you're going to have to just be grossed out by my bully stick pointer. Okay. Also can't light the candles because of Poe. Yeah. Can't have anything nice. I swear to God, there go all my pens. Haven't been able to find the red pen in forever. So you're going to have to deal with orange, purple, green, and pink. That's all I got. All right. Xylazine, also known as Tranq. It is not an opiate. It is a large animal sedative, anesthesia. And it became veterinary use only after failing human trials. What would happen in the late 60s, early 70s, when they were trying it on humans as an anesthetic, patients would get critically hypotensive or their blood pressure would bottom out. And that is the last thing you need while you're in surgery. That can lead to cardiovascular collapse and death. So after a while, they realized this drug is no good for us. But what it was good for was large animals, especially cattle and horses. Now, I have used it in veterinary medicine. My first degree was in animal nursing, and we used it in combination with other medications as anesthetic for dogs. Mostly, though, large animals. Great for horses. Absolutely wonderful. And it's reversed with yohimbe, which animals tolerate far better than humans. The fact, that's lovely. Could you say, excuse me? The fact that now he's going to take my pointer. You're taking my pointer. Okay. The fact that it is not a narcotic is why it makes reversal on the street in street medicine so precarious. You can use all the Narcan in the world. The problem is Narcan affects opiate receptors. It does not affect the Tranq. So then you're left with a patient who is in full-blown withdrawal but still sedated because of the Tranq. And that can be really scary. So we're going to use Philadelphia because most of the studies have been done on Kensington. If you don't know, Kensington is a region of Philadelphia, and it is the world's most famous open-air drug market. People come from all over the world to videotape addicts, to interview them, to photograph them, to study them. Studies were done where they actually rented apartments in the drug market areas and got to know everybody from the dealers to the police to the addicts to the public health nurses, you name it. Anyone walking by, they became friends with. And they compiled a huge study, of which last November 2024, a symposium was done on the results of that study. Fascinating. I'll try to link it for you guys. It's really good. So, 40 years of overdoses in our country. And we know in the 80s and 90s we had problems. But let's take just the last 25 years. So from 2000 to 2006, cocaine was your highest amount of overdoses. 2007 to 2013 was the period of the opiate pill epidemic. I wish it had never existed. 2014 to 2015, heroin made a resurgence and became the top overdose substance. And then in 2016 to the present day, fentanyl took over as number one. Thank you, Milo. Lovely. You'll hear occasional snores. Sir, can I have my pointer back? Can I have my pointer? Can I have your new pointer? No. Okay. All right. Can I have my pointer back? Thank you. Thank you very much. Okay. He's going to take them all. Oh, God, the cat's climbing my back. Tranq entered around 2006, and it came in from Puerto Rico. Now, the reason it was from Puerto Rico is it's a territory. People in Puerto Rico were getting the Tranq, and they were getting it out of China. And also, there was a manufacturer, a bear manufacturer, down in Puerto Rico. And so, being unregulated, because it's veterinary use only, so the FDA isn't keeping an eye on it, it would filter slowly but surely out into the public. And addicts in Puerto Rico were really enjoying it. In fact, they dubbed it Anastasia de Caballo, horse sedative, or back on the island. So in 2006, it entered into the Puerto Rican neighborhoods of Northeast Philly. Why? Being a territory and having very few open bed rehabs, Puerto Rican Tranq patients were being shipped into Philadelphia rehabs where there were beds. When they became patients in Philadelphia, their families moved up to Philadelphia. Unfortunately, many of the family members were also addicts and not in rehab, so they were making connections for a slow but steady train of Tranq to enter. Oftentimes, when people got out of rehab, they found themselves in a new place with a different culture. Even though they're in the Puerto Rican neighborhood, it still was a hard adjustment. Many of them didn't speak English. It was hard for them to get a job or do their classes or do any kind of support. They fell back into the Fetty with the Tranq, and slowly but surely it filtered out to the others. At this point today, it is very hard to find pure heroin. It is nearly impossible. So in animals, xylazine is used as an analgesic, a muscle relaxer, a sedative, or aka an anesthetic. Unfortunately, in humans, it does act as a sedative. It knocks them out. It also is highly vasoconstrictive, which leads to what's called ischemia. And that ischemia leads to the skin ulcers you see. Not to mention, xylazine is highly acidic as compared to heroin and fentanyl. So they don't actually understand fully the process of the Tranq source evolution. But what they do know is that the combination of the constriction of the distal capillaries, all the small, little tiny blood vessels going in your skin, that along with the acid, the more acidic quality to the drug, and having the vessels constrict, trapping that more acidic substance, leads to ulcerations. So you're almost like being eaten, burned inside. So why do they use the xylazine in the Fetty? Well, first off, what a dealer wants is a returning customer. They want a happy customer. They really don't care if that customer passes away, but they do want return customers. Because see, here's the problem. When an addict sees somebody who passed away, It doesn't actually scare them that much. What it does is it tells them, hey, that dude got something really strong. I want some. It's sad but true. And unfortunately, in Kensington, there's a thing called sample day. And a couple times a week, dealers will come out and they'll give samples of their wares away. Remember the mass casualty death in Baltimore earlier this year where like 40 people dropped dead suddenly? That was sample day. Yeah, and they cut it with something even stronger than Tranq. Don't worry, we're going to handle those next. But for now, let's stay with Tranq. So why cut it? Well, first off, Tranq is cheap. And Fetty's cheap. So you put two of them together because you got to cut your Fetty with something, right? Unfortunately, a lot of dealers currently in Kensington are cutting with everything. And I mean everything. They've started testing confiscated samples. And they have found everything from meth to actual bathroom cleaner. You name it, it's in it. There's Xanax. There's, believe it or not, there's Narcan. They're cutting it with everything. And unfortunately, they're putting the Fetty in everything. We had 3 deaths here of 18 and 19-year-olds a couple years ago now who bought themselves half a gram of weed for a party and ended up dead. All 3 of them. Because they didn't know it had fentanyl in it. Sorry, my box is a little worn, but there's my box. I've got a couple of them. I keep them around because of the town I live in. I took an oath long ago, and if I see somebody down on the street, I'm going to help them. I keep this box for my people that live here. I don't know what people do in their private life. But if one of my residents in my complex is down, I at least want to have 2 hits of Narcan prior to EMS getting here. It's a nasal injection, okay? So anyone can use it, right? You undo it, and it's just like your Flonase. You just do this right up the schnozola. Just be prepared to jump back, because after a 2nd, 3rd, 4th round, they're going to come up fighting. Trust me, they come up fighting. One of them went running right out. I always tell this story. And went running out of the unit as the unit was rolling down the street. Was not happy because it immediately takes all the narcotic out of their system. So their high is gone. What you don't see happening as much is quick wake-ups because everything's getting cut with the Tranq. Being a non-opiate sedative, the Narcan doesn't work on the Tranq. So then you're left with a different problem, and EMS has had to find a new protocol on how to handle that. That's not to say you don't use Narcan as a public citizen, okay? Because everybody can go to the pharmacy, your insurance will pay for it. You can go to Costco and get it. Okay? Ask your doctor, hey, I'd like to have some on hand in case my friend, you don't know, one of your relatives may be using. You won't know it unless you see the signs. Sometimes people are really crafty at hiding it. So, it's not a bad thing to have on hand. The problem is you could be hitting them with the Narcan and the xylazine is going to remain. So you're going to still have an anesthetized patient. You're going to want to turn them on their side in case they start vomiting, keep their airway clear, make sure that they're breathing after you've called 911. So, Batty, we found out the wounds are caused from vasoconstriction and the acidic quality of the xylazine. But what do we do with the wounds? How do we take care of them? Well, Batty, I'll tell you how. This is what's called a treatment algorithm for wound care, for xylazine wounds. Yeah, I love flowcharts. I am like a flowchart junkie, but I'm not going to make you read that. Sadly, Batty can't show you the picture down here or any of the other pictures, and that one has to be kind of fuzzy because I don't think YouTube or your stomachs could handle it. I just am going to warn you, if I link this symposium paper, be warned. It's bad. It gets really bad. I mean, like nightmares. Trust me. But first, Batty wants you to know something. Did you know that you don't have to only inject Fetty with xylazine or pure xylazine, which there are some people wanting, in order to get Tranq sores? No. Do you know that if you ingest it, stick it up your butt, called boofing, if you smoke it, any form of putting it into your body causes the sores. And they don't come out where you inject, where you stuck it, where you drank it. They happen to go more frequently to distal parts of your body. Why? Because that's where the acid is trapped in the vasoconstriction. Meet Fetty Frank. Fetty Frank uses. He knows that his Fetty is cut with Tranq, but not a lot, so he's not really worried about those sores, you know? Frank's still crying because he's trapped in a cycle of homelessness and drug addiction, and he can't figure out how to get out of it. Does he really want to quit? Does he not? He's not sure. Sometimes Frank smokes foils, where he puts the Fetty, crushes the pill, and then chops it up on a foil, and he smokes it with the little flame underneath. Sometimes Frank's in a hurry, and he wants a hit fast, so he'll inject it somewhere, usually his arm. For a good time, he'll occasionally boof one up his butt. Yeah, it happens. If Frank's in a real hurry, sometimes he just swallows the pill. Often that happens when the cops are chasing Fetty Frank. Frank started noticing he got little dots, kind of like bruises, little dark spots on his body. He wasn't sure why, because he didn't shoot up in his leg, he didn't shoot up in his foot, or his hand. What the heck? He shot up over here. What's going on? They got bigger, and they turned into water blisters. And he thought, well, that's annoying. And oftentimes they were in places that got scraped or rubbed by clothing or some external force, and they popped. And he thought, oh, good riddance to the water blister. It's gone. He put a Band-Aid on it. He just ignored it. Because that's how they start. A little spot that turns into an imploded crater. Because remember, the highly acidic quality of the Tranq inside the Fetty, cut with the Fetty, ends up festering inside because those veins vasoconstricted and trapped it. And now it's burning from the inside out, creating a little volcano with a water blister that then implodes. It goes down and becomes a crater that will dry up. For continuity, I am using the Oregon Guide for Clinicians on xylazine-related wounds. It is available on Google. Okay? So, they are distinctive. There is no lying about what we see on Trish. They are distinctive. Do you see that word? Distinctive. Once you see a Tranq sore, you can spot them a mile away. Oh yeah, snorting. I forgot snorting. Sorry, guys. I'm old. So, yeah. Wounds often begin as shallow-looking blisters or ulcers on extremities. They can appear anywhere on the body, regardless if you are injecting, smoking, snorting. And yes, you can get rectal ulcers from boofing them. The wounds develop quickly and do not follow typical wound healing patterns. They will eventually eat your bone away. And the symposium, that's why I couldn't show you the pictures, and Batty had to come in. They are open fractures. There are no, the arms and hands are hanging on by like one muscle, literally. Okay? So I'm telling you, be prepared. So they end up being these dark spots. Now, here's one myth. People think that you always need to get antibiotics for it. You do not. Okay? You do not require antibiotics unless you have an infectious process going around. Public health does not want all addicts with Tranq sores running around on Doxy because it's going to make it Doxy resistant. So what they want you to do is have a wound kit. And Oregon actually gives these out for free at the hospital. It contains gauze, an ace bandage, a little bar of soap, and they actually now have rinseless, waterless soap included in the packages. I just saw that. Some Coban, a sterile saline bottle, A&D ointment, and some medical tape, usually paper tape. But Batty, if you don't use antibiotics, isn't it going to get infected? They want you to keep them clean with soap and water or sterile saline. And then you're going to keep your wounds clean, moist, temperature regulated, and covered. They want an army bandage, okay? So they want a non-stick, and then you put gauze over that, and then an ace over it, not tight. You want the wound to stay moist. Don't overpack it. You want to use Aquaphor or A&D ointment, which you can get at Dollar General. I've actually seen A&D ointment at Dollar Tree. Okay? You cannot use peroxide on it, and you, of course, do not use alcohol. Okay? That just kills tissue. Now, if you have a fever, if it turns warm and red and painful, extremely swollen, if there's blood and pus coming out of it, or if it's malodorous, of course, then you're going to get some Doxy, okay? And then if you have symptoms of sepsis, such as fever and chills, confusion, disorientation, difficulty breathing, tachycardia, hypotension, if you're sweating, and if you have a low urine output, you want to go to the ER yesterday. Here is the program, www.oregon.gov/OHA, and then it is the Prevention and Wellness Substance Use Opioids. Now, like last time, every time I try and show an image, they're too gross to look at, and I don't want this, making people sick. But here's a cute little cartoon that shows you little water blisters. Well, we've seen those before, haven't we? Yeah, we have. And then they implode and become necrotic. See, here he is. He's like, oh, I'm not happy now. My water blister popped and I'm just getting dark. And then all of a sudden, implosion. Oh, God, we're necrotizing. And if not treated and not kept clean, it will turn into this, which will turn into that. Okay, you don't want to look at that picture if you're squeamish. So what happened to Frank? Fatty Frank? Did he get better? Yes, look at him. He's so happy. He's wiggling and dancing, and he has a heart on his shirt and a big smile on his face. And yes, he has pinned pupils because he's on buprenorphine, and he is treating his fatty addiction by going to rehab and going to programs and doing sober living. And now Frank is a happy guy. Yes, it's really a diagnosis. Thank you, Milo. It's called Puffy hand syndrome. There's a lot of conditions that have really weird, silly names, and this is one of them, and it's an actual serious condition. It is been around since 1969. And we have a lot of our TikTokers that you can see that have it. Look at Kizzy, left with permanent puffy hand syndrome. A lot of people are. If you've used IV drugs currently or in the past, you have a chance of getting it. It is an alteration in lymphatic drainage due to IV misses and IV scarring, venous scarring from hitting it with the needle too many times. It can happen on one side of your body, on both sides of your body. It can happen in your feet, your hands, or both. It looks like this. X-rays will show that it is just extra lymphatic fluid. It's almost like a lymphedema, a form of lymphedema. Oftentimes it can look like someone who is washing dishes too much or hand washing laundry. So it's easy to disguise for addicts. The problem is it will come and go. The redness can come and go. The swelling will come and go. Or sometimes you're left with it permanently. So in 1969, the physician who oversaw health for the prisoners at Rikers Island started noticing prisoners coming in and inmates coming in, and they would have this. And he started thinking, hey, wait, I'm seeing this too much. What in the heck is going on? So in 1970, he started a study. And he started asking questions and checking out their hands and their feet. And he determined that this was something called, he named puffy hand syndrome, even though it can apply to the feet as well. Everybody is unique, and so everybody's case is going to be unique. Now, combined with the Tranq that's in Fetty, this is a recipe for disaster, because now you have lymphedema and you have constricted vessels and an acidic substance inside, trapped. I mean, every layman can think of what that would do. Here it is without the redness. When they say red, they mean red. And it can get bad. So it's generally painless, so you know it's not infectious because it won't be painful. It's generally bilateral. It can appear several years after you stopped taking drugs. It's unclear what mechanism causes it, but they believe it is due to lymph fluid blockage. Okay? So, of course, how you deal with it is the same as any other edema. You would use compression socks or compression bandages and try and squeeze that fluid back up. Frank doesn't care, though, because he stopped using Fetty. And if his hands get puffy, if his feet get puffy, he doesn't care. Because you know what's better than that? Being clean and sober. Batty is currently being used as a pillow, and I don't feel like being the evil witch, so we'll ask Candy Corn. Oh, wait, here's Batty. Batty's back. Okay. Hi, Batty. Hi, Batty. Batty's also a mushroom. So that was your TED Talk on Tranq sores and puffy hand syndrome, both of which Trish has. We'll be doing another Trish video tonight or tomorrow. Yeah, but I'm going to make a short in a little bit. But for all the new folks that don't want to scroll back to June, this was our third TED Talk combining puffy hand syndrome and Tranq wounds and xylazine. Hope you enjoyed it. Bye, Frank.